Take a moment to look at your fingernails, not just to see if they need trimming, but really look, the shape, the color, the texture. You might be surprised at how much your nails can reveal about your overall health. For older adults in particular, changes in your nails could be an early clue that something's going on inside your body. Healthy nails are generally smooth, with a consistent color and a slight sheen. They grow slowly and evenly. But if you start noticing ridges, discoloration, or brittleness, your body might be trying to tell you something. Let's talk about the most common changes in nails and what they could mean, especially for people over 60. Start with color changes. If your nails turn pale or white, that could be a sign of anemia. Anemia means you don't have enough red blood cells to carry oxygen throughout your body. This is especially common in older adults, and it often goes unnoticed. You might feel tired, cold, or dizzy, but pale nails can be an early indicator. Now, take a look for a bluish tint. If your nails appear bluish or purple, that could mean you're not getting enough oxygen in your blood. This might point to lung problems or circulation issues, both of which are more common with age. People with chronic bronchitis, COPD, or heart disease often notice this bluish shade in their fingertips and nails. Yellow nails are another concern. In some cases, yellow nails are just a result of aging or wearing nail polish for too long. But if they grow thick and curve, and if they seem to grow more slowly, it might be something called yellow nail syndrome. That can be linked to respiratory problems or lymphatic issues. It's rare, but it's worth checking with your doctor. Then there's nail thickness. If your nails suddenly become thick and crumbly, you might have a fungal infection. This is very common in toenails, but can happen to fingernails too. Fungal infections can be persistent and tough to treat, but early action helps. It's also a good reminder to keep your nails trimmed and dry, especially if you wear gloves often or if your feet sweat a lot. On the flip side, very thin or brittle nails can be related to thyroid problems, hypothyroidism, where the thyroid doesn't produce enough hormones, can slow everything down, including nail growth. People with low thyroid often have dry skin, thinning hair, and weak nails that split or break easily. This is common in older adults, especially women. Now look at the surface of the nail. Ridges that run from the base to the tip are usually harmless. They become more noticeable with age, like wrinkles in the skin. But if the ridges run side to side, or if you see deep grooves, it could be something called Bow's lines. These lines can show up after a major illness, surgery, or trauma. They are literally a pause in your nail growth, often caused by stress or physical shock to your system. Another sign to watch for is spoon-shaped nails. If your nails curve upward, like a spoon that could hold water, this might indicate iron deficiency or anemia. These nails can also be a sign of heart disease or liver problems. Again, this is not something you should ignore. If your nails are clubbed, meaning the tips of your fingers look rounder and the nails curve over them, this can be linked to lung or heart disease. Clubbing usually happens gradually, so it's not always easy to notice, but it's worth comparing both hands and watching for changes over time. Some people notice that rings no longer fit properly because their fingertips swell. You might also see small dents or pits in the surface of your nails. That can happen with psoriasis, a skin condition that causes red scaly patches. Many people don't realize psoriasis can affect nails, but it's actually quite common. The pits can look like someone poked a nail with a pin. If you see this and have dry, flaky skin, talk to your doctor. Dark lines under the nails should always be taken seriously. If you see a dark streak that doesn't grow out or go away, it could be a sign of melanoma, a type of skin cancer. Melanoma under the nail is rare, but it can be aggressive. It often affects only one nail and may be mistaken for a bruise or a blood blister at first. If you notice a stripe that seems to widen or darken, get it checked as soon as possible. Nail separation, where the nail lifts off the nail bed, is another sign that something might be wrong. This can happen with fungal infections, but also with thyroid disease or injury. If the nail is changing color underneath, or if it becomes painful, you should see a healthcare provider. Another subtle but important clue is nail growth speed. Nails grow more slowly with age, but a sudden slowdown could be a red flag. Your nails might reflect nutritional status, circulation, or metabolic health. Poor blood flow or low protein levels can delay nail growth. Let's talk briefly about nutrition. Your nails need certain nutrients to grow strong. Protein is one of the most important. Nails are made of keratin, a type of protein. If your diet lacks enough protein, or if your body has trouble absorbing nutrients due to age or digestive issues, your nails will show it. Biotin, a B vitamin, also plays a role in nail strength. While most people get enough biotin from food, certain medications and conditions can cause deficiencies. Zinc, iron, and magnesium are also key players. Seniors are more likely to have mild deficiencies, especially if appetite has declined or digestion has changed. Staying hydrated is just as important. Dehydrated nails become brittle and peel easily. So if your nails are cracking or splitting, think about your water intake. Dry indoor air and certain medications can also dry out your nails. Certain medications themselves can affect nail health. Chemotherapy, for example, often causes nails to become discolored or fragile. Other medications, including blood thinners and beta blockers, can lead to changes in nail color or thickness. If you notice a change shortly after starting a new medication, let your doctor know. Your nails can also reflect your lifestyle. If you use your hands a lot, whether for gardening, cleaning, or even typing, you may see wear and tear on the nails. Gloves can protect your hands during chores, and moisturizing your cuticles helps maintain nail health. Cutting or biting your nails can lead to infections, especially if you damage the skin around them. Seniors with diabetes should be extra careful, since small infections around the nails can become serious. If you have diabetes, watch for redness, swelling, or pus, and treat even small cuts around the nail right away. Finally, your nails are part of your overall self-care. Taking a few minutes each week to inspect them, trim them, and moisturize the skin around them is a great habit, not just for appearance, but as part of a bigger picture of health awareness. In summary, your nails might seem small and unimportant, but they can offer valuable insight into your health. From anemia and thyroid issues to lung disease and nutritional deficiencies, these tiny changes can be early warning signs, so don't ignore them. If you see something unusual, talk to your doctor. They can run simple tests to check for underlying problems. You know your body better than anyone else. Pay attention to what it's telling you, because sometimes the first sign of a bigger issue isn't pain or fatigue. It's right there at your fingertips.